So these are the objectives for today's brief introduction. So by the end of this presentation, you should be able to identify the main aim of using the seminar as a learning tool, then how to use seminar to improve their oral as well as the written communication skills, then understand the seminar's aim to explore and develop new perspective related to the provided topics, and then fourth is recognize the topics to be covered during growth and development seminars. So to begin with, these are the 8 topics. So we have 8 topics in this whole block. Okay, so it will be covered in 4 weeks. Okay, so each week there will be 2 topics covered. Okay, so the first seminar will be the first hour, and the second seminar will be the second hour of the each week. Okay, so next week there will be this is the introduction we have already presented. Then we'll have the IVF as well as the seminal analysis. Okay, so the next week we'll have these 2 topics, IVF as well as the seminal analysis. Then after that week, in the third week, we'll have the types of pelvis as well as the fetal skull. And in the fourth week, we'll have the delayed milestones as well as the mental retardation. And in the fifth week, we'll just have the revision of all these things. Okay. So actually, there are 6 seminars. Okay, 6 seminar topics. The introduction is today's, so that is not included. So the third, fourth, fifth, sixth, seventh, and eighth. Okay, there are 6 seminars. Okay, 6 topics, and in 3 weeks you will present all this. Okay, so you are 14, I think, in your group. M1, there are almost. Why there are 17 students here? Why all have joined this one? Those who are in M1, they should join M1 group. Those who are in M2 group should join the M2 group. There is Dr. Malas who is taking the M2 group. So if you are joined here, those who belong to the M2 group, please go back to the Dr. Malas link. Okay, there are different links. Okay, for M1, boys 1, this is the first link. Then boys 2, there is second link. Okay, by Dr. Malas. So I have already sent you the group of the students who are present in M1, M2, and in the female groups. So by now you should know which group you belong to. Have you checked it? Okay, so there are 14 in the M1 group. So you will take the 6 topics. Okay, so each topic will be taken by 2 to 3 students. Each topic means 2 topics will be there. So almost it will be 2 topics by 3 students. One student will present one topic, and he can share one more with 1 or 2 objectives with one student and the other topic with the other student, or you can take individual topics. Okay, there are 6 topics there, and you have 14. So 2 students will take one topic, and the remaining 2 will manage with adjusting with somebody else. Okay, did you choose the topics for yourself? Did you go through these topics? So there is IVF. IVF means in vitro fertilization. In vitro fertilization. Then the second is seminal analysis. Then after the next week, these 2 will be covered in the next week. And after that, we'll have the types of pelvis and the fetal skull in the third week. And in the fourth week, we'll have the delayed milestones and mental retardation. And the fifth week will be just for the revision. So I will just discuss briefly the objectives for you, and then you can go in detail. So as I said, the title is IVF, means in vitro fertilization. In vitro fertilization. Okay. Once again, I'm telling you why there are 22 students here. There should be only 14 students here in this group. There are only 14. There is a separate link for M2 students. M2 student, they should have a separate link with Dr. Malas. Okay. Today,
دكتور.
Dr. Malas. Okay. So there is second group for the boys who are in the M2 group. They should join him. There is a separate link there. Let me show you.
دكتور.
Yeah.
Uh, دكتور, how many students to each topic?
As I said, there are 6 topics. So there are 14 students here. Okay. So 2 students will take one topic. Two students will take one topic. Okay, and the remaining last 2 they can adjust with somebody else. If you see, let me show you the Dr. Mala's link. Stop sharing. Then share. See here, there is a separate link for those students who belong to M2 group. This is M1 group, and there is a separate link for the boys M2 group. So those who belong to M2 should join Dr. Mala's group. Okay. Today it is okay, but from next week onwards, you should join the proper groups. Okay, all groups are separate. Okay. Okay. Coming back to, yeah. Okay, coming back to the IVF, the topic of IVF, in vitro fertilization. So you will, in this, that is called as in vitro fertilization, where you will discuss some of the important topics related to this. That is, you will try to identify what is infertility. What do you mean by, you should be able to describe what is infertility. Then you should be able to define and describe the steps of IVF, in vitro fertilization, how you do it, then describe the different uses of this technique, and describe the side effects and risk of in vitro fertilization. So 2 students can take the first 2 topics, first 2 objectives, and the second student can take the other 2 topics. Okay, other 2 objectives. So if your 2 students are sharing, then you can take one student can take the first 2 objectives, and the second student can take this next 2 objectives, and they can present. Okay, in the first hour of the next week, and this is also in the next week. Seminal analysis, another 2 students will take this topic, 2 objectives, one student, and the 2 objectives by the other student. Okay, so here you will be able to describe what is semen, what do you mean by semen, and the purpose of seminal analysis. Why do you do this seminal analysis? First, you should be able to tell the composition, how the semen is made up of. Okay, what are the things which are there within the semen, and what is the purpose of the seminal analysis. One student will describe this with a presentation. You will have PowerPoint presentation. You should be able to prepare a PowerPoint presentation and present it just like the teachers. Then the other student will list the parameters measured through the seminal analysis. What are the things which you will measure in the seminal analysis? What are the things you check? Okay. Then the terminology is related to the seminal analysis. This also will be done by the other student. So 2 students can divide it. The first 2 objectives can be taken by one, and the second 2 objectives will be taken by the other. So these 2 topics, IVF and seminal analysis, will be for the next week. Then in the third week, you will the types of pelvis as well as the fetal skull will be covered. 4 students will take these 2 topics. Okay, first 2 objectives by one student, the second 2 objectives will be by the other student. And here, one student will take the anatomical structure and he will describe in detail. Okay, and the other student can mention about the different sutures and fontanelle as well as the closure of the fontanelle, the second 2 objectives. Okay, so in these types of pelvis is the hip bone. Hip bone is called as the pelvis. Okay, so the 2 hip bones with the sacrum, that is called as the pelvic girdle. So you should be able to define what is pelvic girdle with pictures and description. Then you should be able to describe the bones and ligaments sharing in the formation of the pelvis. Okay, so you'll be discussing more than what is there in this objective, okay, with details. Okay, and the other student will describe the types of pelvis. There are different types of pelvis: male pelvis, female pelvis, and other things. Then they should be able to describe the clinical application. Why should you study these types of pelvis? How it is relevant? How it is more important in case of females? So all those things you will describe. And here in this fetal skull, one will describe the anatomical structure of the whole fetal skull, how it is different from the adult skull. Fetal skull is a speciality where you should know the details of the fetal skull. Then the other student will describe the different sutures and fontanelles at the proper time of closure of the fontanelles and its clinical importance or implications, how it is clinically important, so that you will be able to describe. One will student will describe, because fetal skull anatomy is quite first you should be able to tell the normal anatomy in adults, then you should be able to differentiate it from the fetal skull. Okay, then the other student will tell about the sutures and fontanelles and how they close and what is the clinical importance. Okay, how do you measure the age by that? Okay, all those things. And in the fourth week, two students will take the first two objectives. Then the next student will take the other two objectives, and one more student will take up the last objective. Okay, one will define the developmental milestones. How do you measure the age by the milestone? There's something called a milestones. Okay, so you should be able to describe the milestones, then the four domains of the development, then the importance, developmental milestones during the first 2 years, very important age of the child. Okay, then what causes delayed milestones and the symptoms of children with delayed milestones. Okay, so that we should be, these two can be clubbed together by, can be given by one student. The important developmental milestone can be given by the other student, and the third student will give these two objectives. And eighth also by the three students. Okay, so the mental retardation, define mental retardation, identify different causes of the mental retardation, then identify some types of mental retardation, then identify specific approaches to deal with the mental retardation, and mention some preventive measures. Okay, so these two objectives again can be taken by one student. The other student will take the types of the mental retardation, and the other third student can take these two, define mental retardation and identify different causes of the mental retardation. So three students will take the eighth seminar and the seventh seminar. So it will include all the 14 students. Okay. So if you have not made up your mind till now, go back and discuss with yourself, all you 14 students who are in the M1 group, and by evening today decide and tell me who will take up which topic, and all should take at least any of these topics. Okay, so all should be involved, nobody is left over. Okay, if not he will lose the mark, so he should join. Okay, so decide among yourself and take up the topics, and be ready for the from the next week we'll start. So we'll start with the this topic IVF as well as seminal analysis. So each week, as I said, there will be two topics taken and presented by 4 or 6 students. So then coming to how do we assess you? Okay, once you present, what are the things we'll take care? Okay, evaluation, that is called as evaluation. For simplification of purpose, a primary form containing a checklist with recommended criteria used for making the score. So we have a criteria, there is a complete sheet on which we will make out the student's performance. So these are the criteria. One is presentability. Okay, so we check his language, how he will present the the seminar, and what is the language, how good he is in presenting. Then the format, how exactly he will produce the different topics, the specific objectives are covered or not, as well as how the way of presentation within the PowerPoint. So is it in order or not, that we'll see. Then we'll see whether he will use videos or not. So if it is relevant, important, you can use videos also. Then we will very specifically see the pictures, how exactly you will see the use the pictures. Okay, so just you will just attaching a picture on the PowerPoint without explaining it doesn't work. So you should be able, if you are showing some pictures, you should be able to show what is the important, what is the why you are using this picture, where exactly is that structure which you are showing. So you should be able to use the pictures properly. And if you are using the graphs, you should be specific and you should be able to show. Then the voice, eye contact, because right now we on the online, so we don't have the eye contact, but the voice, how clear is his voice, that will check. Then the movements, again movements we cannot check because we are online, but interactions we will expect the other student to ask questions. So we'll see, as well as the presenter can ask questions to the other students and they can answer. So it is vice versa. So there should be interaction. It should not be one way as right now it is happening. I'm just presenting and you are just listening. It shouldn't happen. Okay. It should be two-way communication. You should be able to ask questions as well as I will be able to answer, as well as I can ask you questions as well as we should be able to answer it. Okay, so this will carry almost 40% of the marks. This is called as presentability. The second is the scientific proficiency, okay, or efficiency. How exactly the scientific material is used. Okay, here we'll see the content accuracy. So what you're presenting is accurate or not, whether you are taking it from uh, vague websites or you are taking it from authentic websites and authentic material is used. Okay, so content accuracy is very important, as well as content organization. As I said, organization is very important. So you should start with the definition and other things in order. It should not be haphazard. First you will present the clinical application, then you will give the definition or something like that. It should not happen. It should be in order. So that is called as the content organization. Okay, that is very important. Then integration of the basic medical sciences with the clinical aspects is very important. How do you use the, just as an example, how do you use the fetal skull? As we saw, you will be presenting the fetal skull, how it is clinically important, what are frontanels, how it is clinically important. So you should be able to correlate the basic anatomy and physiology, pathology, or all those things with the clinical aspect. That is very important. Okay, then you should be able to tell us where exactly you took this information. Sometimes we might ask you, because sometimes the content might not be wrong or it might be very good also sometimes. So we might ask you to cite the reference. So you should be able to cite where exactly you took this information from. And you should not copy and paste everything from somewhere, or you should not download some powerpoints and present the same thing without any editing. You should be able, even if you download, you should be able to edit to according to your objectives. Okay, don't put all the information whatever was there and present it. Okay, so try to prepare your own, prepare your, and you try to cite the references. So this will carry the other 40 marks, 40% of the marks. That is 4 marks here, 4 marks here. Okay, 8 marks. And the remaining 2% will be, that is 2 marks will be for the teamwork. How exactly you will be able to cooperate with each other, as well as the coordination between the students. Okay, the two presenters, how exactly they will coordinate, how the one end and the other will begin from exactly from there. Okay, and he should be able to correlate whatever information he is giving with whatever his colleague has given already. Okay, so that is called as the cooperation and coordination, as well as the other students who are listening. So whether there is coordination and communication between this. This is how it will be the last 2 marks. So 4 marks for the presentability and the 4 marks for the scientific accuracy, and the teamwork will be 2 marks. Nowadays we have changed it. The presentability will be 2 marks, and we will give more importance to the scientific. So here it will be almost 6 marks. Okay, and the teamwork will carry the last 2 marks. So these, all these are very important when you are presenting. So take up the topics, and you should be able to, by today night you should be able to list the topics, and in front of the topic, you should be able to give me names, and all 14 students should be involved, and they should choose the topics as well as the objectives and give me the list, final list. Okay. And from who are presenting next week, they should be prepare the PowerPoint presentation by this weekend. And before you present, you should be able to show us. Okay. Before you present, you should be able to show us for any alterations and changes. Okay. So at least by Sunday, you should be able to submit us the PowerPoint, so that if there are any changes, we can recommend. Okay, so this is all about the seminar. So if you have any doubts regarding the seminar presentation, you can ask me. Whatever things you want to know, you can just ask me. Yeah.
دكتور.
If you have any questions regarding seminar, how to present, what are the
Yeah,
things,
دكتور.
you should be able to tell.
دكتور,
Yeah.
the presentation will be at the college
No,
or
no, yeah,
online?
yeah, it is online, online,
Oh, okay, online. Thank you.
online, but you should be able to have PowerPoint presentations. Okay. So you should show to your teacher, whoever is there, for each seminar, at least by Sundays, so that by Tuesday you should be ready with the seminars. Okay.
How many slides do we need for each objective?
Each objectives, there at least you should have total 10 slides, total slides for each objective, maybe because there are only two objectives, maybe 5 slides for each. Okay, so you should be able to discuss in detail. It is not it is not fixed that it should be 5. It can be 4 or 5. Okay, so we prefer that you should be able to explain in detail. Okay, 4 to 5 slides are okay, fine with each objective. So that you should take at least 20 minutes to present your part. Okay. Any other question?
Doctor, you'll choose our partner, or we choose
No, no,
each other?
you choose me. I'm giving you the liberty. I can choose. I can just put the names and I can just assign you. But I think I will give you the liberty to choose yourself and tell it by today evening. Okay. Make out the
Thank you,
list of
doctor.
the students. I have already sent you the list. Discuss with all your friends and decide and tell me by evening who will be taking which topic and which objectives. Okay. So all
Thank you.
topics will be taken and all you should decide. If you don't decide, then I can put directly. Okay. So I don't want to force you to any topic. So you can choose. You have the liberty to choose till today evening. Okay. So what else? Any other questions regarding this? So did you get the criterias? Okay. The presentability, the scientific proficiency, as well as teamwork. Is it clear for you how we grade you, how we give you the marks? So as I said, presentability will carry 2 marks. Okay, scientific proficiency will carry 6 marks. Okay, there is a change, a recent change here. Okay, and the teamwork will carry 2 marks. Okay, so we give very importance to the scientific proficiency, where the content, scientific content, will check about that. Okay, so whatever things you give us, we should be able to cite the reference where exactly you took the reference, and you should follow some standard textbooks or the web links, not search in Google and get the information. Search some standard websites, and we have all the reference. I have given already the books as well as the reference link in the student guide if you want to know. Okay. Anything else you want to know here?
Thank you,
Thank you,
doctor.
Doctor.
Everything is clear?
Thank you, Doc.
Okay. So today evening you will give me the submit the list of the students who will be presenting.
Yes, I hope, inshallah.
Okay. You have given your attendance?
Yeah, we done the attendance in the model.
Okay. Okay. Thank you very much.
I did not. not. I
Yeah.
actually have a problem with logging in into Moodle.
If you log in late, then you will have problems because it will be just 15 minutes.
No. The website is buffering.
Mhm.
The website buffers.
Just logged in, there was no problem. Maybe in your internet on your side.
No.